Paige Bueckers suffered a tibial plateau fracture on this play, and in this video, we're going to break down exactly what that means. Welcome back, everybody. I'm Dr. Brian Sutterer, and this is your #1 source for learning about the unique medical side of the world of sports. Bueckers is extremely fortunate here that this injury wasn't more severe, because a knee hyperextension like this always has the potential to result in something more significant like an ACL tear. The word we've gotten from Uconn is she has a tibial plateau fracture and is expected to be out for around 6 to 8 weeks. Breaking down the play here, initially it almost looked like she just hurt her ankle from this kind of view from behind. Certainly there we can see the ankle inverts a little bit, but this was truly a knee hyperextension. It's really best appreciated in this side view when Bueckers comes down the court. You can see right here that hyperextension of the leg. Now, extension is whenever we straighten the knee. Flexion is when we bend our heel up towards our butt. And so here, the fact that her lower leg, the tibia, has extended forward past that sort of normal neutral line, hyper, meaning extra, extension. If you envision just a line coming down here continuous with her femur, you can see how that tibia is hyperextended out this direction. Looking at our biodigital anatomy tool here, I've highlighted some key structures of the left knee. And what we have to really first focus on is going to be the femur, the thigh bone, and the tibia. Of course, Bueckers' injury is a fracture of this tibial plateau. And so plateau, of course, meaning kind of shelf or table. And so the tibial plateau is basically this uppermost sort of shelf or upper portion of the tibia. When we remove the menisci, the ACL, the PCL, the tibia is relatively flat, as opposed to the femur, the thigh bone, has this nice kind of rounded contour of the femoral condyles, but you can see the tibia is pretty much like a flat little tabletop. So the tibial plateau is this upper portion. And so Bueckers' fracture is presumably somewhere kind of around this upper portion of the tibia. As her tibia swings forward and hyperextends, that's going to put excessive compression on this anterior portion of the knee joint. It's that force of the bones pushing together that causes more of a compression type injury, which results in that tibial plateau fracture. I'll tell you, knee hyperextensions are really challenging to determine severity on just based on how they look. You can have a severe hyperextension like Giannis suffered last year and only missed like 10 to 15 days, but that same degree of hyperextension could result in a season-ending ACL tear. One component that seems to relate to this is not just how much hyperextension there is, but also the amount of varus or valgus stress, meaning essentially how much the knee is coming inward or outward. That can put some additional load on structures like the ACL, but bottom line, these are really tough to just look at and say, yep, it's definitely this or definitely that. One thing that we can gather from just this backside view here is her knee is certainly caved inward a little bit. And so what that's going to do is it's going to preferentially load more of the outer portion of the tibiofemoral joint. So I would suspect maybe that tibial plateau fracture is more on the outer or lateral portion of the tibia, just looking at this angle, but really impossible to say just from looking at the severity for certainty something like an ACL tear or PCL tear. Now, part of this conversation has been, why was she in the game? It was a blowout. It was the very end. And I will say there's one interesting piece of this. As Bueckers' leg is swinging forward here, her hamstring is trying to fire to slow down that forward extension of her leg. And essentially in this position, when you hyperextend like this, your hamstring's not able to fire adequately enough to slow down that forward extension. And so you put yourself in a position where you can have this hyperextension. You could certainly postulate that her hamstring was fatigued. It was the end of the game. And so it wasn't able to adequately fire to slow down this terminal swing of the leg. And that's part of what led to the hyperextension. So I think there is kind of a reasonable conversation to be had there, but again, it's hindsight, it's 2020, and we can't necessarily put blame on that specific situation. Long-term, a situation like this always does make us question sort of that neuromuscular control, that strength and stability, because this isn't a situation where you should typically have something like a knee hyperextension, just dribbling down the court and having your leg terminally swing out. I'm sure they're already doing some ACL injury prevention stuff here at Uconn, but this is another example of a time when we really have to implement those strategies hard and make sure Bueckers has really optimal knee control, really good knee strength and stability, so that hopefully when she's in situations like this the rest of her career, she is able to control that leg swing. She's able to fire her muscles to ultimately protect her knee. So that's it for the video, everybody. I hope this was educational. I think it's the first time we've talked about tibial plateau fractures. Definitely not the first knee hyperextension, and I'm sure won't be the last. So a kind of unique scenario with that hyperextension. Let me know as always any questions or comments down below, and until next time, we'll see you later. Bye.